everyone, so we're Group 8 and today we'll be talking about healing through crystals, also known as crystal therapy. So first we'll be giving an introduction on crystal therapy. So what is it? A brief history, why we should all care, its services and benefits. We'll be talking about chakras, healing stones, and also treatments and regulations, followed by therapeutic uses for physical health, mental health, and pain. We'll also be taking a look at alternative views, including Reiki, meditation, prayer, and crystal bath therapy. And to conclude, we'll be looking at gaps in the literature and determining whether crystal therapy is quackery or evidence-based, followed by a demonstration using crystals, a group activity, and lastly, a class discussion. So what is crystal therapy? So the word crystal actually originates from the Greek word kristallos, which means coldness drawn together. And crystal therapy is an alternative medicine in which crystals or gemstones are used to promote healing by balancing one's energy vortexes, also known as chakras, within the physical and subtle bodies. Crystal therapy falls under energy-based medicine and KAME classification, so a crystal healer's perception of what it means to be healthy is quite different than that of an allopathic practitioner. While allopathic practitioners view health with more emphasis on the absence of disease, crystal healers view health as the absence of blockages occurring in the chakras of the body. It's believed that when there are blockages or imbalances in these chakras, disease or ailment occurs. And so this is where crystals come into play. Crystals are believed to possess the ability to hold and emit energy vibrations and balance chakras back to their natural energy levels, which would mean bringing the individual back to a healthy state. Throughout history, crystals have served many purposes in many cultures, including healing, protection, decoration, and adornment. Although it's unclear when and where exactly crystal therapy was first used, it's believed to have originated in Egypt and Mesopotamia, where crystals were used for protection and healing. Earliest usage is also linked to Ayurvedic medicine, which originates in India, as well as ancient Greece and Rome. Today, there's a renewed popularity and growing interest in crystal therapy in the West. So why should we all care? Well, crystals are claimed to be a powerful healer, promoting healing of the body and the mind. Some benefits of crystal healing include relieving pain and stress, promoting energy balance, and inducing deep relaxation. In a time where we're moving farther away from seeing health as merely the absence of disease, crystal therapy works to bring balance within the whole body. However, this form of healing lacks credible research, as very minimal research has been conducted to substantiate its claims. A typical crystal therapy session takes around an hour per session, where crystals are placed on or around one of the 7 main chakras of the fully clothed individual. Crystals are selected based on desired effect, and this is because crystals have different properties such as color or mineral content that determines what ailment or disease the stone can heal. When the points of the crystal are directed away from the problem area, it's meant to move energy away from that area. On the other hand, when the points of the crystal are directed towards the problem area, it's meant to recharge that area with energy. It's used to treat a wide range of ailments, including pain, stress, circulation problems, insomnia, epilepsy, headaches, infertility, muscle spasms, nervousness, rheumatism, and wounds.
So now I'll be discussing how crystal healing theoretically works. To start off, I'll be talking about the principles of crystal healing. So our bodies are dynamic electromagnetic beings with a constant outflow of energy, which includes physical, emotional, and spiritual. Crystal healing uses energetic vibrations from crystals to balance out our natural vibrations from our body and make us feel a certain type of way. In order to understand crystal healing, we need to talk about this idea of chakras. The word chakra means wheel or disc, and it references a spiritual energy center within our body. The idea of chakras originated in India between 1500 and 500 BC, and we have 7 major chakras that align with major nerve bundles and organs within our body. So any disruption in healthy energy flows caused by blocked or unbalanced chakras leads to disease or illness. So as I previously mentioned, there are 7 major chakras, and the way they are organized in our body are bottom up. So chakra 1 would be the root chakra located at the pelvis, whereas 7 would be the crown chakra located on the temple. So now I'm just going to get a little bit in depth about each chakra, its location and function, and the stones used to balance it. So we're going to start off with chakra number 1, which is the root chakra, and the color of this chakra is red. It's located at the pelvis and it regulates survival. So when this one is balanced, the individual feels centered, grounded, and stable. and you can use stones like rubies, bloodstone, and tiger's eye in order to balance this one out. Second, we have the sacral chakra, which is located on the lower abdomen. The color of this one is orange, and it regulates creativity and sexuality. So it helps with feelings of sexuality, passion, optimism, pleasure, sensuality, etc. And you can use citrine, moonstone, and tiger's eye to balance this one out. Then we have chakra number 3, the solar plexus chakra. The color of this one is yellow, and it's located right above the navel, and it regulates sense of self. So when it's balanced, you feel confident, good self-image, you have great self-esteem, and you can use yellow topaz, citrine, amber, and rose quartz to balance this one out. And then we have our heart chakra, which is green, and it's located in the middle of the chest. So this one regulates things like love and affection, and it's linked with feelings of love and peace and good relationships and gratitude. And then you can use emeralds, green tourmaline, jade, and rose quartz to balance this one out. Next, we have our 5th chakra, which is the throat chakra, and the color of this one is blue, and it's located at the bottom of the throat. It regulates expression, so it's connected with communication and listening abilities, and you can use blue topaz, aquamarine, turquoise, and lapis lazuli to balance this one out. Next, you have the 3rd eye chakra, which is the 6th chakra. The color of this one is indigo, and it's located between your eyes, and it regulates intuition. So it's linked with the ability to manifest with inner wisdom and clarity, and you can use amethyst and fluorite to balance this one out. And finally, we have our crown chakra, which is the 7th chakra located on your temple, and the color of this one is violet. So its responsibility is to connect the individual with the spirit realm, with the God consciousness and a higher power. And it's associated with oneness, spirituality, awareness, and wisdom. And you can use amethyst, jade, and rock crystal, as well as clear quartz to balance this one out. So now I'm going to talk about the 5 most popular crystals and their properties. We do discuss other crystals in the presentation, but these are the ones that I find are most commonly talked about in relation to crystal therapy. So starting off with the first crystal, it's selenite, also known as the Master Stone, and its metaphysical healing properties are that it's connected to the highest level of consciousness, so it relates to the spirit guide, the universe, and intuition. And this could also be used to cleanse and recharge other crystals. Its physical healing properties, meditating with selenite can bring the individual inner peace, and it assists with judgment and insight. Next, we have the clear quartz, which is the spirit stone. So this one contains the full spectrum of white light, so it can help with amplifying desires, prayers, and manifestation, and it represents the clarity of mind. Its physical healing properties are that it stimulates the immune system as well as the circulatory system, and it increases the flow of chi energy or life force around the body. Next, we have rose quartz, which is the love stone, and this one can assist with finding love and giving love, and it helps deepen and nurture your love in a relationship. For physical healing properties, it's centered around the heart chakra, so it can improve circulation, lower blood pressure, and even help relieve tension. Finally, we have amethyst and amber. So amethyst is known as the manifestation stone, and it connects the individual with their true desires and their life purpose, aids in bringing the ethereal realm into the physical plane, and it brings dreams to life. And for the physical healing properties, it boosts the sympathetic nervous system, it balances out hormones, it relieves headaches and tensions, and it's usually used to treat insomnia. Finally, we have amber, which is known as the master healer. It cleanses the mind, body, and spirit. It draws disease from the body and renews the nervous system, and it helps balancing out the left and right brain. And this one, for the physical property, it has anti-inflammatory, anti-analgesic properties, and it alleviates pain. Here we just have a little summary chart of the different types of physical conditions and the gemstones used to cure them. For example, infertility, you could use coral. For epilepsy, there's jasper. for muscle spasm, amazonite, etc. Okay, so now I'm going to talk about the types of treatment. So there are a bunch of different ways that you can use crystals for therapy. The first one is electrocrystal therapy. So that's when you use a special camera to scan the body's auric field and then relay it onto a computer. Then the therapist marks areas of stress and dysfunction, and then 5 electrodes are placed around the body or affected areas and chakra points, and it's connected to a quartz crystal immersed in saline solution and sealed in a glass electrode with a battery. And then you use that, run a current through, and that's the first form of treatment. The next, you have gem essence. So basically, a gemstone is immersed in pure water and it's left in natural sunlight. And then the vibrations from the sunlight goes through the crystals and runs that vibration into the water, creating this crystal essence. And you can use this essence by adding it to massage oils, adding it to your bath water, drinking it, or just spraying it around your body. And then finally, we have chakra cleansing and revitalization. So with this type of therapy, you're using different stones and creating crystal bodywork. So you're placing the stones or corresponding chakras in order to balance that chakra out. Now, as for the regulations of crystal therapy, there are no medical regulations on crystal therapy specifically. Crystals can be bought at specialized crystal stores, and the sales of these stones are regulated under international trade laws. However, practice of crystal therapy is regulated according to the normative standards of the types of therapy being used. So what that means is, for example, if you're using manipulative therapy, this type of therapy is regulated under the Health Professions Act and the Chiropractic Act, and the practitioner must be registered as and or licensed to practice manipulative therapy in that province. So now we've reached our first content check. So which of the following is not a claim of crystal therapy? A, it relieves pain and stress. B, it induces deep relaxation. C, it increases serotonin. Or D, it promotes energy balance. The correct answer here is C, increases serotonin, because we did not discuss serotonin levels in relation to crystal therapy.
So next we're going to move on to the therapeutic uses of crystal therapy. And before we dive into the literature that we found, I think it's important to mention that even while crystal therapy has been used for years as a part of alternative and complementary medicine, that the general knowledge we have of the healing powers of crystals is limited. Extensive literature searches on this subject reveal that there is a scarcity of validated information on crystal therapy, and that the information we do have tends to be unvalidated. So that's why while we have included some scientific literature on this topic in our presentation, in reality, there was not enough available to cover all aspects of crystal therapy regarding physical health, mental health, and pain. So we've turned to the next best available piece of evidence, including information coming from books written on crystal healing. And although we are not solely dismissing the claims of crystal therapy as superstitious, I think it's important to look at where the knowledge of crystal therapy is coming from, that being anecdotal and traditional beliefs, and that these are sources of knowledge that are going to be different from peer-reviewed medical literature, and that is important to consider in terms of the information that we see coming from these sources. And it's found that the seeming success and pleasant feelings of crystal healing are attributed to a strong placebo effect. So now we're going to look at how crystal therapy is used in respect to one's physical health. In a book entitled Gemstone Energy Medicine, it is touched on that the crystal emerald is used to heal the physical body, and that one can wear emerald if they are experiencing essentially any unwanted physical condition ranging from chronic fatigue all the way to cancer, and that wearing the emerald will help to solve these issues. So now we're going to look at the benefits of wearing a therapeutic emerald necklace. The benefits of wearing therapeutic emerald is that it helps resolve many types of physical disharmony because of the green rays that it carries, which raises the vibrations of the physical body, giving it healing vitality. Emerald heals in the areas of greatest disharmony in the body, which is where sources of physical health issues such as disease tend to be found. When you first wear emerald, its energy and green rays flood your auras and locates these areas of physical disharmony, and then travels to these areas to neutralize the disharmony. So Emerald's order of work. Emerald works in stages where it will target and remove the physical disharmonies first and foremost to improve physical health, and then it will move on to negative emotional energies that are believed to be causing these physical conditions. In looking at the time guidelines, it is said that emerald should be worn long enough to keep constant saturation of your aura with green rays, which essentially means to wear it the whole time one is experiencing a physical health condition, as well as sometime after the physical condition has been healed, in order to be sure that the condition has been fully expelled from the body. We're now going to take a look at a testimonial by Alan Kaufman, who is a licensed acupuncturist. And basically, it states that 6 years ago, he started to see a patient with AIDS just as he was entering into a hospice, and he began taking the AIDS retroviral drug cocktail and wore a solid emerald necklace 24/7, and in just 6 weeks the measured HIV viral load in his blood showed a decrease equivalent to results typical of taking the AIDS cocktail by itself for a full year, and today he's thriving and is healthy and is running his own successful business. And with this, we can start to see some of the red flags in terms of emerald being seen as this kind of magical healing property. However, there is no scientific backing for this, which I think ties nicely in with the limitations that I noticed from this reading. Yes, so to continue on from the last slide I was just talking about, the limitations that I see from this literature on crystals is that there is a lack of verification in terms of where this information that the author is writing about, in terms of emerald healing the physical body, is actually coming from, and whether or not it's validated. We see the use of testimonials, which might make it appear to be super successful, but then again, that's just one person's experience, which may be confounded with many other variables that we don't know about. And the information that we do see here on the healing power of emerald is extremely broad in the sense that it says it can essentially fix all physical ailments. So in terms of future directions, I believe that better ways of determining efficacy, such as empirical evidence, needs to be implemented instead of relying on what testimonials and single individuals are reporting, and that there really should be a narrowed down scope as to what specific health ailments emerald or any other crystal for that sense can solve, because saying it can improve any health condition, physical health condition, is just unrealistic.
So in this section, I'll be talking about crystal therapy and physical health. The study was done on mystical stones and its effects in oncology. The study dives into whether crystal healing power is real or if it's nonsense. To start, crystal healing, gemstone therapy, lithogemmotherapy have all been promoted in the media within the last decade. There has been a growing interest for cancer patients in this unconventional treatment, which has been resulted in the need for oncologists to inform patients that this form of therapy is not evidence-based and is ineffective, and to prevent them from wasting hope, time, and money. Although the treatment is regarded as harmless and without toxicity, it still shouldn't be recommended to cancer patients as it can delay proper treatment that they require. Also, any form of pleasant feelings or seeming success that has been noted from crystal healing is strongly attributed to the placebo effect. Crystal healing practitioners place crystals on different parts of the patient's body that are correspondent to different chakras. The healing process is supposed to remove blockages in the auras of your body's electromagnetic field. As shown on the image on the right, which is figure 1, that's of the crystal quartz, and the crystal wands, which are denoted as a magic wand-like structures with a crystal or gemstone at the top, were placed near a receiver's body or near certain blocked chakras. All of this was thought of to cure cancer. This study was conducted to evaluate whether an individual would feel positive sensations through crystals in respects to oncology. It explored the possibility that the sensations from the crystals were just due to the practitioners priming them. Priming is when you talk about crystal therapy before the treatment and bring about a preface of its effects. The study consisted of 80 volunteers, half of which were male. Some were customers from a New Age stone store, as well as undergraduates and non-students. Participants were given either a natural quartz crystal to hold or a fake crystal that was made of glass. Afterwards, they were asked to report any sensations such as tingling, heat, relaxation, or any mood changes. Some of these participants were primed to expect certain sensations and reported these sensations more frequently, as opposed to being non-primed. To finalize and sum up this study, there are no differences found in effects reported between those who handled real crystals versus fake crystals. The study was a repeated study that was originally done in 2001, but this time it was made double-blinded. It's also been found that the priming effects did not have significant effects, and once again, no differences between holding a real and a fake crystal. The study concludes that the fact that the same effects were found with both genuine and fake crystals undermine any claims that the crystals have the mysterious powers which they claim to have. Also, the power of suggestion, either explicit or implicit, seems to have not so much of a mysterious power that may convince others that the crystals have the potential to work miracles. The limitations of this study are small sample sizes, lack of resources, and the study is inconclusive of all the possible aspects. The future directions are including more trials for the study and using a variety of different crystals as each one is different.
Next, we're going to take a look on what the best available literature has to say about the use of crystal therapy and crystal healing on mental health. In a book entitled Healing Crystals for First Aid, they talk about the use of crystals in treating depression. And just a little background information on depression. It is mentioned that in the beginning of every case of depression, there is a dejection factor that is often overlooked. And dejection factors include feelings of hopelessness that can arise from many circumstances, including social and/or family situations that may have arisen, as well as the development of health conditions. And that real help for depression can only be given by finding out what this dejection factor is and then working on a solution. And usually therapeutic assistance is needed in this process to work through bouts of depression, but crystals are also seemingly used in addition to therapeutic assistance as they encourage openness, the ability to confront unpleasant things, and the willingness to work on oneself. So in this next slide, we see that the following crystals are commonly used in addition to therapy to aid in the treatment of depression. So the first one is Amazonite, which is used to help with despondency. We also have citrine, which helps deal with depression caused by overwhelming external influences. And then finally, we see opal, which brings enjoyment in hopeless circumstances. And these above crystals are worn on the body for long periods of time in which the depression is experienced, particularly on the solar plexus. So in terms of the limitations of this evidence, we see that there is essentially no scientific support available on using crystals for treating depression. So there's a lack of scientific proof on whether or not they're actually beneficial. We're once again relying on the use of books as our best available piece of evidence for this. Also, the use of crystals for mental health is not objectively known and is based on the subjective opinion of the author of this source and the individuals using these crystals for depression. As well, there is the potential for the placebo effect in that the presence of crystals may make individuals feel as if they're overcoming their depression, but really it could just be from the fact that they are receiving therapy simultaneously to using the crystals. And in terms of future directions, I believe that scientific methods should be used to draw conclusions about whether crystals actually aid in the treatment of depression, including a better focus on certain types of crystals in this investigation so that there is a better indication of what actually works or if anything works, rather than suggesting that many crystals can kind of all work towards treating depression, which may be a little broad.
In this section, I'll be talking about crystal therapy and pain. The study was about whether or not wearing amber necklaces was correlated to preventing teething pain. For more than 20 years in European countries, parents have placed amber necklaces on their children to avoid health disorders with a special consideration for teething pain. There has always been proposed potential risk of strangulation and choking associated with these necklaces. Another risk associated with amber necklaces could be bacterial contamination. The aims of the study were to quantify bacterial colonizations of amber necklaces worn by infants during hospital consultations and to look at the reasoning for infants wearing them. This study was an observational prospective study. It was concluded in a French pediatric center where bacterial analysis of necklaces and required all participants' parents to complete questionnaires. All the children who wore amber necklaces and were present at the emergency department or pediatric dermatology department were included. The study included 27 children. The median age was 10.7 months and 70.4% were females. The infants had necklaces from a median age of 4.1 months, and bacteria developed on all of the necklaces and 32 different species were found on it. However, 63% of parents indicated that the amber necklaces helped with teething pain for their child. Necklaces were indicated to either be moderately or highly effective in 74.1% of the cases. However, 70.4% of parents still considered the use of these necklaces as risky. To finalize and sum up the study, amber necklaces could include infections in subjects with acquired defects of their immune system. Parents considered the benefits and the risk ratios of amber necklaces to be positive for health, especially for teething pain, which is the reason given in 63% of the cases. The effects of amber necklaces might therefore be due to the placebo effect, since most parents found them to be effective, by a subjective measure. The limitations of this study are a small number of patients, a potential lack of diversity of the study population. All the patients' children were seen at a hospital in single-center study. The future directions for the study are using more quantitative measurements and avoid basing it on a subjective measurement, and to use priming in separate groups to predispose them into believing that the amber necklaces will reduce pain, thus will show more of a demonstration on the placebo effect.
Moving on, we also have another example of crystals being used for pain management, specifically in this case for period pains. So coming from a book entitled Healing Crystals for First Aid, we see that period pains are a serious, often individualistic issue that many women experience and should be discussed with a professional if they are persistent. There are many known causes of period pains, and it is suggested that the following crystals can relieve such pain no matter what the cause is. So both biotite lenses and malachite are such crystals that are said to help alleviate pain from the point of when the discomfort first begins during one's period to relieving cramp pains themselves, as well as regulating emotions. I think that it's clear from much of the resources that we've seen on crystal therapy and crystal healing thus far in the presentation that the same applies here, that the use of crystals in the relief of period pains has no true scientific backing to it. We're simply relying on the word of an individual and the sources of information in which this book was written on, without knowing where they're obtaining this information from. There is also no indication of how these crystals work to alleviate pain. They are just plain and simple said to stop period pains no matter what the cause. In terms of future directions, it is crucial to objectively evaluate the use of these crystals in the relief of period pains using more empirically backed up evidence to see if there actually is an effect or if it's solely a placebo effect.
We've now reached our second content check. So, which of the following is an important consideration regarding the literature on crystal therapy? A, an abundance of validated information exists. B, sample sizes are large and effect sizes are significant. C, sample sizes are small and effect sizes are not significant. Or D, crystal therapy research supports its effectiveness. So the answer here is C, sample sizes are small and therefore the effect sizes are not significant.
So because there is such a wide range and variety of crystals with different healing properties, and the practice of crystal therapy is non-abrasive, it makes it a great alternative therapy and can be easily used in conjunction with other therapies. So the first alternative therapy is an energy therapy. known as Reiki. It's very similar to crystal therapy, and it uses both a hands-on or hands-off technique, and it's more focused on the energy healing of the practitioner used on the patient rather than the crystal's energy used on the patient. So it uses a similar bed like a massage, quiet settings accompanied by soft music, very calming, and the practitioner will use something referred to as palm healing, and perform a scan of the body area or the body, one chakra at a time. Let's see. Sometimes they do have a pendulum, which is most commonly made of crystal. It's just a crystal on a, what's it called? A necklace. So basically just something you can swing or hang above them. And depending on the rotation of the pendulum, clockwise or counterclockwise, this will determine what type of energy, negative or positive. And the practitioner will either place their hands very lightly, it's very light touching, to focus energy, or they will just hold their hands above the patient. So the way that they focus on the chakras is each chakra is connected to a specific organ or body part, and the goal is to balance the patient's energy as a whole through the individual chakras. And there are many Reiki healers that actually use crystals in their Reiki practice by placing the appropriate crystals on the according chakras. So another alternative therapy I looked at was a mind-body therapy known as meditation, which we did cover in class. One of the groups did cover. To just go over, it is the action or practice of resting the mind and attaining a state of consciousness different than normal waking state. And crystals can actually enhance the experience of meditation. It's really a personal preference of how you use them. If you want to hold the crystal, place them on you or around you, whatever is most comfortable with the individual. So in terms of specific crystals that can enhance meditation, I picked a few here. Clear quartz, which is a clear crystal and is used to enhance intuition and filter out distractions. Amethyst, a very common crystal used, known as the stone of spirituality and contentment, can enhance spiritual progress and strengthen intuition. Selenite, which is very similar to clear quartz. It looks a little more like salt, if you will. It is a restful crystal that brings wisdom and balance. And then in the bottom left, we have blue topaz. It is for mental clarity and emotional calming, so it's kind of another calming crystal. Black tourmaline in the middle. It's protective and grounding stone, said to absorb negativity. So this is kind of a more protection stone than a calming or a clarity stone. And then the last one there is rose quartz, which is the stone of unconditional love and said to enable the flow of love and compassion of oneself and others. So basically it opens up the individual to love and compassion. And these properties, knowing the properties of crystals and having the knowledge really helps you enhance practice. So prayer was one of the brief mind-body therapies we discussed, and crystals can actually be used to enhance prayer. It's not uncommon for some cultures and religions to use prayer beads and pendants as a pawn or a material bond for spiritual guidance, and growth during prayer. And it's not always crystals. I know I did see a lot of wood beads and pendants in my research, but just some of the ones that would be recommended to enhance your spiritual experience would be moldavite, which is known as an extraterrestrial stone, said to enhance spiritual growth and offer protection, and some other commonly seen bead or crystals used in prayer is amethyst and black tourmaline. So one of the last alternative therapies I covered, it is newer and less regulated. There's little research on it, but there's a little bit of science behind it. It's actually called crystal bath therapy, also known as the John of God crystal chakra bed. It focuses on light and chromotherapy, which is color therapy. And how it works is you can check out the quick video demonstration below, but I'll just give you a brief description. It's the use of 7 Vogel quartz crystals suspended above a massage table, which light is emitted through it onto the patient, which lies face up and simply relax under the lit up crystals. So each crystal emits the according color for the according chakra. And the goal is that it promotes an overall sense of well-being by aligning one's energy field or aura. Similar to Reiki, but they do it through, instead of palm healing or crystals, they do it through light and color. So some of the science behind the crystal bath therapy is inspired by Marcel Vogel, which is what the crystals are named after. And he did a lot of research on crystals and their healing properties, and he believed that when you cut and polish the crystals in a specific way, it produces different wavelengths when light passes through, but it needs to be cut in a specific way in order to assure that it amplifies and transmits the right energy properly to the universal life force, which he refers to as our consciousness, our soul, or our being. And his research actually paved the way for crystal therapy. So there is little research to support color therapy, but I think it's very interesting, and I wanted to share this quote that I found. Colors have a profound effect on us at all levels, physical, mental, and emotional. If our energy levels are blocked or depleted, then our body cannot function properly, and this in turn can lead to a variety of problems at different levels, which is very similar to what was stated about chakras earlier in the presentation, as if they are blocked or depleted, our body cannot function properly, and this in turn leads to further problems at different levels. And further in the research, they explained that how light and color actually affect us is because of the electromagnetic radiation, or otherwise known as radiant energy. The wavelengths of the colors is believed to have an effect on our hormones and other internal processes, which was said before, how the chakras, they are all connected to different organs and parts of our body.
So, to wrap up our presentation, I want to tie everything together by first talking about the gaps in the literature. When we take a look at the research that is available on crystal therapy, it is crystal clear that there is not enough research done to support its effectiveness. The studies that were conducted, however, did not yield significant results, and the studies had one thing in common: small sample sizes. So why do people still turn to crystal therapy, and why is its popularity increasing? Well, perhaps it could be because of the placebo effect. Research available to us suggests that crystal therapy works predominantly under the power of suggestibility. One prime example we discussed were patients who were given both a real crystal and a synthetically identical crystal and were unable to tell the difference between the two. Finally, the third major criticism of crystal therapy is the amount of access to evidence-based research. There is very little studied under controlled conditions, but plenty of unvalidated literature originating from blogs, personal testimonials, ancient books, and self-proclaimed specialists in crystal therapy. We must ask ourselves, is it evidence-based or is it quackery? Well, it is not one product does it all. Sometimes it's a quick fix, but no, it's not a miracle cure, and there are no conspiracy theories either. However, it is all natural, and there are many personal testimonies that advocate for success. But in the end, we do conclude as a group that it is quackery.
So for the activity portion, we intended on bringing in a variety of crystals that we purchased on Amazon. And these included tiger's eye, amethyst, rose, and clear quartz, amongst others. So we wanted everyone to refer back to the lecture slides, to refresh on the stone's properties, and then everyone would have had the opportunity to choose which crystal they wanted to meditate with that would help them balance out any stresses or problems they were currently dealing with. For example, I would have chosen the amethyst stone because I'm trying to manifest good grades this exam season. And then we intended to run about a 3-minute meditation session with the crystals, and we wanted to wrap it up by discussing how to charge the crystals. So in order to charge them, they would have to be placed in a stream of direct sunlight or moonlight every 2 to 4 days. And then everyone would have had the opportunity to keep the crystals, take them home, and they would have been encouraged to use them regularly. And then we intended to touch base again with the class on our final review session to see if anyone had any thoughts or feelings about crystal therapy after having tried it for a few weeks.
Lastly, we also put together a little quiz for you guys to test your knowledge. You can find the quiz at this link provided below. The last segment of our presentation will involve discussion questions. Firstly, crystal therapy has been around for millennials. However, it has no scientific basis. Why do you think this form of healing continues to gain attention and popularity, even though the effect is attributed purely to the placebo effect? As we discussed in class, not all therapies can be summed up and evaluated using the golden standard research method. However, an understanding of cultural and contextual factors that play a role in crystal healing is more essential to understanding crystal therapy. Different ways of knowing also have a role to play in this. So even though empirical knowing isn't a strong look at this therapy, in terms of ethical knowing, aesthetic knowing, and personal knowing, we can better understand the effects of crystal therapy. And as with all CAME therapies, crystal therapy is more appealing because you have more time with the practitioner, there are no side effects, and it's natural and holistic. So taking a look at the role of spirituality, it connects us with a higher consciousness. It's related to religious practices, and it's linked to meditation, and it's proven to be effective in that sense. So in turn, I ask you, do you think that if crystal therapy garnered greater scientific evidence, that it could have a potential future in Western medicine? So we do think that it is possible. There are limited research studies on crystal therapy, so based on this, we can't come up with a solid conclusion. However, it is a holistic form of treatment and can be used as a complementary therapy. Currently, we've also seen an increase in the use of gem essence in skincare products. This indicates that there may be an effect after all. So, I would like to thank you for tuning into our presentation. If you would like to read more, please check out our references where we have tons of sources, and we do implore you to take a look at crystal therapy.